75-year-old 912 ambulance, 75-year-old male, back pain, 211 Silver Hollow
Road. Inflammation and infections of the eyelid. Occlusion of secretion of a gland can cause swelling of the eyelid. There are two major conditions that result in swelling of the eyelids. 1. Chalazion, which is a non-infectious inflammation of meibomian gland. 2. Hordeolum, which is infection of the eyelid. Hordeolum. A hordeolum, commonly known as STYE, is an acute, localized swelling of the eyelid. STYEs are caused by dirt and debris that block the hair follicle and get infected by bacteria. The most common bacteria, known as Staphylococcus, are responsible for 90 to 95% of STYEs. There are known two types of hordeolum, external and internal. Most hordeola are external and result from occlusion and infection of an eyelash follicle and adjacent glands of Z's or Mal glands. An internal STYE, which is very rare, results from infection of meibomian gland. Common symptoms of STYEs are pain, swelling, tenderness, burning sensation, itching, difficulty blinking, increased sensitivity to light. Spontaneous rupture is rare. Because internal STYEs are so rare, they are not usually suspected unless infection is severe or fever or chills are present. Conventional treatment, hordeolum. You should not attempt to make any incision on a hordeolum unless you're a medical specialist. An external hordeolum that does not respond to hot compresses can be incised with a sharp, fine-tipped blade. Treatment of an internal hordeolum is oral antibiotics and incision and drainage if needed. Topical antibiotics are usually ineffective. First of all is a bacterial culture is the best to find an effective antibiotics, but local antibiotics like chloramphenicol drops 1 drop 4 to 6 times a day in the affected eye, or chloramphenicol ointment 2 times a day. If it didn't work, a more broad-spectrum antibiotics like oxytetracycline and polymyxin BI ointment is almost always effective. It's known as terramycin polymyxin BI ointment. Depending on severity of the infection, oral antibiotics can be used, like dicloxacillin 500 mg capsules, 4 times a day, or erythromycin capsules 250 mg 4 times a day can be tried. I prefer to prescribe a mixture of a local antibiotic, oxytetracycline, and a corticosteroid, because it has a good effect on both hordeolum and chalazion. It's known as Terracortal. Chalazion. A chalazion is non-infectious occlusion of a meibomian gland, causing irritating oil goes into the eyelid soft tissues with inflammation as a result. Disorders that cause abnormally thick meibomian gland secretions like meibomian gland dysfunction, increase the risk of the gland occlusion. As the secretions of the gland thickens, oil is slowly gathers inside the gland, so it gets swollen and inflammation as the result. Initially, the eyelid is diffusely swollen, but after 1 or 2 days, it localizes to the body of the eyelid. Typically, a small non-tender nodule, or lump develops. Symptoms are like a hordeolum at least in the first 2-3 days. A chalazion typically occurs in a person with an underlying inflammatory condition that affects the eyes or skin. Some of these conditions include chronic blepharitis, acne rosacea, seborrheic dermatitis, earlier STYE or chalazion, viral infections, tuberculosis, skin cancer, diabetes. Treatment: a chalazion usually drains through the inner surface of the eyelid or is absorbed spontaneously over 2 to 8 weeks, but rarely, it persists longer. Usually incision and curettage at your ophthalmologist office is chosen, but sometimes injection of 0.05 to 0.2 ml of a corticosteroids like triamcin alone, in concentration 25 mg per milliliter, in combination with a topical corticosteroid would be enough. Chronic chalazion that do not respond to treatment require a biopsy to exclude tumor.
Please give us feedback about this video. We like to improve ourselves, so we welcome any constructive comments, and if you have any experience or personal videos about other treatments for mentioned conditions that you want to share it with us, please send it to email drontube@gmail.com. Our goal and hope is that you can use this knowledge to help others in need.